everyone, so in today's video we are going to be talking about adverse effects which are being caused by tetracyclines. So first of all, hypersensitivity reactions to tetracyclines are uncommon. So they do not cause reactions which are basically due to allergy or sensitivity, in which there can be drug fever or skin rashes or things like that. That kind of adverse effects are uncommon to tetracycline, and these are more common to penicillins and some other antibiotics. So most adverse effects are due to direct toxicity of the drug or due to alteration of microbial flora. As we know, microbial flora is present in your gut. What these tetracyclines do is that they disturb those normal flora and cause some disturbances which lead to certain conditions. So, if we talk about gastrointestinal adverse effect of tetracycline, nausea, vomiting, and diarrhea are the most common reasons for discontinuing tetracyclines. These effects are attributable to direct local irritation of the intestinal tract. So, what these drugs do is that they actually cause irritation or stimulation of the walls of intestinal tract. In that way, it will cause diarrhea or nausea or vomiting, because when a substance is irritating to walls of intestinal tract, obviously intestinal walls will try to get rid of that substance in a way by causing diarrhea or vomiting or nausea. So oral tetracyclines can rarely cause esophageal ulceration. So as they can cause, but they do this thing rarely, we instruct patients to take tetracycline with 8 ounces of water and remain in upright position so that esophageal ulceration will be avoided, because esophageal ulceration usually cause when there is back movement of the things which are in your stomach. So to avoid that, patient should remain in upright position so that it doesn't come back into esophagus and cause ulceration. Tetracyclines alter normal gastrointestinal flora, so with suppression of susceptible coliform organism and overgrowth of pseudomonas. So tetracycline actually cause suppression of coliform organisms which are normally present in gut, which are good for normal or healthy being of intestinal tract. So when that organism is being suppressed, there is overgrowth of pseudomonas or proteus or staphylococci or resistant coliform and clostridia and candida. So all these microorganisms are now in increased amount in the GI tract, and in this way there will be resultant of there will be functional disturbances in the intestines, and there can be anal pruritus or vaginal or oral candidiasis. Clostridium difficile associated with colitis, which is inflammation of colon. So it can also cause that. However, the risk of Clostridium difficile colitis may be lower with tetracycline than other antibiotics, although the rate of cause of colitis associated with Clostridium difficile is lower than which is being caused by other antibiotics. Now, if we talk about bony structures and teeth. So as we have discussed in previous videos of our mechanism of action of tetracycline and pharmacokinetics of tetracycline, that these agents actually form chelates with metalines, and this can ultimately cause fluorescence or discoloration or enamel dysplasia, and all of these conditions occur when there is deposition of tetracycline in the bones or teeth because of the formation of chelate with the calcium. So that's why we should avoid tetracycline in pregnancy and children younger than 8 years. So enamel dysplasia is actually a condition in which normal level of once tooth enamel is disturbed, and in fluorescence there will be yellow to golden fluorescence under UV light because of the deposition of tetracycline in the teeth or bones. So this is how tetracycline affect teeth or bone, and it may cause deformity or growth inhibition. That's why we should avoid this in pregnancy as well as in children younger than 8 years. If we talk about other toxicities which are being caused by tetracycline, tetracycline can impair hepatic function, especially during pregnancy in patients with pre-existing liver diseases and when higher doses are given intravenously. There are three conditions under which there can be hepatic dysfunction because of tetracycline. First of all, in pregnancy, we should avoid tetracycline. Secondly, if a patient is already having some kind of liver disease. Thirdly, if we are giving high concentration of uh, tetracycline to a patient through intravenous route. If a patient is having a daily dose of 4 gram or more intravenously, he or she can have necrosis, which is death of the cells in the liver. So if a patient is having expired preparations of tetracycline, there can be acidic condition being developed by the renal tubules, and there can be Fanconi syndrome in which there is inadequate reabsorption in the proximal tubules of the kidney. So these things can happen, and tetracycline given along with diuretic may cause nephrotoxicity. So nephrotoxicity, which means toxicity in the kidneys, can be, or nephrons can be occurred due to combination of tetracycline along with diuretics. So tetracycline and minocycline may accumulate to toxic level in patient with impaired kidney functions. Intravenous injection can lead to venous thrombosis. Thrombosis, as we know, thrombosis is a clot formation in the veins, and that can block the flow of the blood. Intramuscular injection should be avoided as they can cause pain and local irritation. And systemic administration of tetracyclines commonly induce sensitivity to sunlight and ultraviolet light, particularly in fair skin person. If a person is having fair skin complexion, in those patient chances of getting sensitive to light or sunlight or ultraviolet light because of the intake of tetracycline. Dizziness, vertigo, and tinnitus have been noted, particularly with high doses or prolonged administration of minocycline. These symptoms may also occur with high doses of doxycycline. So, vertigo is the condition in which patient face imbalance. This is usually because of the disturbances in the inner ear, and in tinnitus there is a bell-like sound, which is also due to the disturbance of the inner ear. This was all about the tetracycline. If you want Urdu or Hindi version of this video, please find link in the comments below. Thank you for watching, and make sure you subscribe to my channel.